Believe it or not, Republicans, at least those in the Senate, have figured out why health care is so expensive.
Because we've removed all the benefits of a free market competitive system.
And they've even figured out how to fix it, almost.
Take some of the $36 billion a year and open up health saving accounts and offer a new plan that doesn't exist today with a higher deductible, which will lower cost.
Most Americans do not believe they ought to pay for health care anymore. We're going to have to change that psychology in order to bring back consumerism into healthcare. It's going to take some time.
Yes, it'll take people a while to get used to it, but that's okay. You know how to do it. Just do it. Match those high deductible accounts with health savings accounts funded not by enhanced Obamacare subsidies, but the original Obamacare subsidies. People will pay for most of their health care out of their pockets, as it should be, and use the insurance for extraordinary costs, as it should be. And Obamacare will finally become real health insurance for the first time. We finally got the details of the Republican Senate alternative to the enhanced Obamacare subsidies on the day it failed. The Cassidy-Crapo bill would have put $1,500 a year into HSAs for Obamacare enrollees earning less than 700% of the federal poverty level and enrolled in the lower-priced copper or bronze insurance plans in 2026 and 2027. The funds could be used for out-of-pocket expenses, but not to pay for premiums or for abortion or gender transition services. It failed, as did the Democrat bill to extend those enhanced subsidies for another 3 years. The House remains deadlocked with no vote scheduled, so the issue will probably carry into next year. So far, Democrats are not accepting anything other than the enhanced Obamacare subsidies, which they created, which helped produce the sky-high insurance rates that you're looking at for next year. How high? That depends on your income. Tomorrow, we'll show you a couple of tables to give you a pretty good idea of how high they will be if this issue remains unresolved. I told you yesterday I'd give you some examples today of the new Obamacare premiums without the enhanced tax credit. The best way to do that is to go to kff.org, look for the interactive calculator, and here are our 4 examples. The first example is a 40-year-old single mom with 1 child earning $40,000 a year. Her new premium will be $203 a month as opposed to $52 with the enhanced credit. Second example, married couple, 40 years old, 2 kids earning $100,000 a year. Their new payment will be $830 a month as opposed to $523 with the enhanced credit. Our third example is a 60-year-old single person earning $65,000 a year. They will have to pay $1,598 a month for Obamacare as opposed to $460 with the enhanced credit. And our fourth example is a married couple of age 50, no kids, earning $100,000 a year. Their new premium will be $2,103 a month as opposed to $708 with the enhanced credit. What I find interesting about all of this is that the premiums, the unsubsidized premiums for Obamacare, changed very little between 2019 and 2025. But a big jump is expected in 2026. Why? The best answer I can get is the unsubsidized ACA premiums are higher because insurers are finally charging what the coverage actually cost. Huh? The only spending debate in Washington these days is over those enhanced Obamacare tax credits, and Senator Bill Cassidy has a new offer for Democrats. I don't see how they're going to be able to turn this down because it sounds to me like he's offering them everything they want and everything he wants too.
You've got to put cash in the patient's pocket to pay the out-of-pocket. I would be willing to do a short-term extension of the premium tax credits for those people with higher premiums if they will concede that we've got to do something for the $6,000 out-of-pocket. I think there's a deal to be had here. We need to push for that deal. That $1,500 is per person. Give me a couple in their 50s with 2 children, 18 and 19. They would get $5,000 in an account to pay the out-of-pocket for the insurance. Now, the insurance plan for that couple would be $6,000 deductible.
Now, I may be missing something, and if I am, I'll tell you when I get a chance, but it sounds to me like Cassidy's new plan would be twice as expensive as either the Democrats or his original idea. I'll try to share the House plan tomorrow, but I needed to get to this first. It sounds like we might be building a whole new spending tower with Obamacare. There's not a lot of reporting on this, so the details are still a bit murky, but the House does plan to vote tomorrow on a number of GOP proposals dealing with health care. One part would expand association health plans, which would allow more small businesses and self-employed people to band together to purchase health insurance. Another part would increase transparency in prescription drug pricing. by requiring more data from pharmacy benefit managers. Speaker Johnson might allow for a separate vote on extension of the premium ACA tax credits. Some centrist Republicans are aligning with Democrats to push their own proposals for those enhanced Obamacare tax credits. 2 Republicans had enough GOP signatures on discharge petitions that, if the Democrats joined them, they'd be able to force a vote. But the Democrats haven't joined them because they've got their own discharge petition, which the Republicans have not yet signed. None of the proposals include more funding for health savings accounts, which the Senate Republicans want. Their plan was defeated last week, but they're not giving up on it. All of this may or may not become a little bit more clear by the end of the week.